Hello, I'm Dr. Mike Miller, and I'm the Director of Microbiology Technical Services, which is a private consulting service for diagnostic laboratories around the country. I'm also retired from the Center for Disease Control after 35 years, and I've had a lifelong interest in specimen management and clinical relevance. Now, there are a lot of references that are available for you in this regard, and one has been produced by the American Society for Microbiology, and there are many others that are available to you. So I want to welcome you to this most informative series of demonstrations of specimen collection for diagnostic microbiology. Clean catch urine specimens from adults are likely the most common specimen we get in the microbiology lab, and it's one of only 3 or 4 specimens that patients collect themselves. Therefore, the job of the medical staff is to verbally explain how to properly collect the specimen. Now, in addition to verbal instructions, there should be illustrations available in the bathroom or area where the patient will collect the specimen. Although our initial concept of urine being sterile in healthy individuals may be changing somewhat, it is critical that we receive a specimen from the bladder that is not contaminated with urethral or skin flora that can mislead our interpretation of results. For symptomatic patients or those with painful urination, urgency, frequency, one specimen is usually adequate for diagnosis, and another could be collected 48 to 72 hours after initiation of therapy. For asymptomatic patients, 2 to 3 specimens may be necessary. Pooled 24-hour collections are not helpful in microbiology and should be discouraged for culture. It is helpful on the requisition to indicate whether or not the patient is symptomatic because it helps the laboratory to interpret low-count quantitative urine results. Also remember that urine is a really good culture medium, so all specimens not sent to the lab within 30 minutes of collection should be held in the refrigerator. There are some facilities, however, that ship their specimens to another laboratory, and they may use a boric acid container for that specimen, which may or may not need to be refrigerated. Most of our specimens arrive in a sterile, screw-capped urine specimen cup. But some specimens may be collected from the port of a urinary catheter, and others may be collected by a straight in and out catheter by the physician. All of these would arrive in the sterile specimen cup. The microbiology lab will note the source. For collecting from catheters and the use of straight catheters, specimen collection should be performed by healthcare personnel who have completed training and demonstrated competency. For clean catch specimens, be prepared to instruct the patient in a language they can understand. For clean catch, we need a sterile screw-cap specimen container, antibacterial soap, and ordinary soap is acceptable, or commercial preparatory packages, gauze sponges, and rinse water. Explain to the patient what they need to do and hand the patient the cleaning and collecting materials. Now, for females, we would say sit comfortably on the toilet and swing one knee to the side as far as possible. Spread yourself with one hand and hold yourself spread while you clean yourself and collect the specimen. Clean from front to back between the folds of skin, not back to front. Be sure to wash and rinse well before you collect the specimen. After washing, rinse with a water-moistened pad with the same front to back motion. Use each pad only once. Then hold the cup with your fingers on the outside. Do not touch the rim. First, pass a small amount of urine into the toilet, and then pass enough urine into the cup to fill it half full. Carefully replace the lid on the cup tightly, or ask the nurse to do it for you. For males, we would say retract the foreskin if you're uncircumcised, and clean the glands of the penis first with the soap pad, then rinse with water or wipe from front to back with the moistened gauze. Hold the collection cup with your fingers on the outside. Pass a small amount of urine into the toilet and then collect enough urine in the cup to fill it half full. Screw the lid on carefully and give the specimen to the attendant. Now the collector should label the container properly. If the specimen is not taken to the lab within 30 minutes, put the container in the refrigerator until it can be taken to the microbiology lab, unless you're using the boric acid container, and that need not be refrigerated.